Hi, good afternoon, everyone. Welcome to our Unit 3 discussion of ST-120. Today, we're going to talk a lot about different types of decontamination and disinfection techniques. So we're going to talk about those principles and techniques for decontaminating different items, including like specialty items or sensitive items, and obviously incorporating our med term and PPE talk in all of these, right? We always incorporate those. So these are your assignments for this week for Unit 3. Notice there are quite a few like little quizzes that go along with this week, so just keep on top of those. I know it seems like a lot, but these typically go pretty quickly. With your discussion, just make sure you are citing all your sources in APA format. That is something I think I see the most with students. If you don't know how to do that, please reach out to me. I can direct you in the right way or find you some examples, whatever you need, especially like links. Just copying and pasting a link at the end of your discussion isn't going to get you the points. That is not APA format. Okay. So reach out if you have any questions concerning those. All right, so let's start with the question. Why is it important for central service techs to know how to handle decontaminated items properly? This one might be a bit of a given, especially if you look at this picture. Kind of gross right down here at the bottom. But it's important for you to understand all the ins and outs, the nuances, even the smallest details of how to handle these items because A, you need to protect yourself, and B, you need to protect your patient. That's the whole goal. We can narrow all of it down into those things because if you don't do those two things, you're going to end up hurting yourself or your patient. You could end up causing a patient to get another type of infection, which could honestly lead to killing that patient. A lot of patients, obviously, who come in the hospital are already fighting off other infections. They have other what we call comorbidities that really lower their ability to fight off other infections. So any little thing that they pick up while they're in the hospital could be detrimental to them. So we have to be very careful with the entire process. And that starts back at decontamination before it goes through the rest. So let's talk about first point of use preparation. So when we're talking about point of use, that's like when I teach this to my surg techs, I tell them whenever a surgeon gives you an instrument back, you start cleaning it off, you wipe it off. Now, at the end of the case, certain facilities may have you process that a little bit different before they send it back to you at decontam. They may have you spray the tray of used items, instruments, with something like an enzymatic cleaner. Some facilities may have you wipe everything down with a moist, like lap tape moistened with sterile water, not saline, sterile water, or even soaked in some sterile water. So it may depend on your facility, but that is point of use. Like as you're using it, keep it clean. Because what happens is if you leave a lot of what we call gross soil, not that it's icky, although it is sometimes, gross means like obvious, visible. Gross soil, if you leave all that gunk, for lack of a better term, on those instruments, it makes it very hard for the sterile processing tech to clean it off later in decontam. So I always tell my students to keep those instruments clean. Not only does it make it harder to clean, if you don't, it's going to cause instrument damage. It could lead to further cross-contamination of, keeping that clean and dirty separate. It's going to wear those instruments down and even during surgery, make it not as effective, like scissors. They don't cut as well when they're full of like dried blood, right? So gross soil, like I said, here is defined as any tissue, like body fat, blood, anything that's gotten visibly on those instruments. So other sources of contamination can include, like as you're going through this whole process, even all the way into the case cart. At the end of the case, now that we've used all of our items, we put the dirty items back in and send them down to sterile processing. Usually that's how most places work. So it's contained. You're going to get items for other departments as well that may not have the same type of things as surgery, but they're still going to be contaminated. So you got to make sure you don't, you keep clean and dirty separate. So point of use preparation. So like I said, instrument decontam begins at the point of use. So the whole point of this is A, to make it easier to clean, B, it prolongs the life of the instrument, I should say. If you leave that dried blood or tissue, whatever it is, on those instruments for an extended period of time, the metal on those can actually break down, which is going to ruin them over time. It might shorten the life of those instruments. It also makes it a lot harder to clean. Dried tissue, and you're going to see this in this one of your activities or assignments that you have to do. You're going to be soaking some instruments in something gross, maybe like, just to give you some examples, like I've seen students use like barbecue sauce, honey, maybe even glue, something just that's going to be a little bit of a challenge for you to practice cleaning your instruments off. Okay, and you'll see once it dries, it is harder to clean off. I mean, it's no different than if you've ever done the dishes, right? If you let it sit and it like hardens on your plate, okay, you might have to put a little bit more elbow grease into cleaning that off, right? It's no different with instruments, okay? Also, if you leave those instruments with gross soil debris on them, it promotes something called biofilm. So biofilm is something that a bacteria makes, not all bacteria, some bacteria can make in a way that basically it's like their self-preservation method. So bacteria try to keep themselves alive, even though we're trying to get them cleaned off or killed, whatever the process is. So they create this biofilm that helps it stick to whatever surface, like the instruments, in order for them to stay there and replicate. So the longer they sit there, the more likely they are to form that type of biofilm, which is going to make it even harder. All right, so some simple guidelines here with point of use processing. There are several like really important things that we have to follow. Even though we are let's say wiping them down or even spraying them with enzymatic cleaner, whatever the process at your facility is, it does not replace the cleaning process and decontamination. Still has to be done. It's just going to make it easier. Okay. In the OR, we remove the gross soil. We're also going to follow IFUs because not all instruments can be processed in the same way. We're going to talk about some of those specialty items like scopes, very delicate things later. Okay. And also with sharps, we'll talk about sharps pretty often, almost weekly, because you're going to come in contact with these, especially in the decontam process. Some sharp instruments now, reusable sharps need to be separate. And I teach my surg tech students this as well. You keep your sharp items all together. Never just stray your sharp items everywhere. They need to all be neat, organized together for easy identification, so you don't end up accidentally sticking yourself or someone else sticking themselves because of your carelessness. Also, you're going to separate reusable linens. They'll have to be processed a separate way. Usually a separate company comes in and takes care of the linens most often, and then brings back the clean ones. Remove disposable items. Never just send, because what ends up happening is every now and then a disposable item might get like snuck through, like maybe you missed it, it was in the tray, whatever. Then it gets reprocessed and then it becomes an issue later, and it shouldn't be reprocessed. So watch those disposables. Always keep your hinged instruments open. That way they are easy to clean inside the ratchet, the hinge, whatever. Anything that's assembled needs to be disassembled, right? So you can get all the parts clean. Always keep heavy instruments on the bottom and the lighter instruments on top. That seems like might be self-explanatory, but you'd be surprised how often I see it's usually carelessness, just throwing things in the tray and trying to hurry up, right? The instruments that are heavy have to stay on the bottom because we have a lot of small, very delicate items that can be easily damaged just by something else being placed on top of it. So whenever the surgeon would go to use that next, maybe the tip of that very very thin, delicate, maybe forceps or scissor, got just bent just slightly, that just even millimeters of being bent can mess up a microsurgery. So be very careful with those. Okay. Keep instrument sets together. That's a hard one. Because there are times when surge techs will have trays upon trays, 10, maybe 20 trays of supplies and instruments, implants, whatever, on their table, and it can be challenging to remember where it came from. I'll be honest with you. So sometimes they're marked. Certain facilities will have them marked, but that's a challenge. You may have to look them back up when they come back down. Again, keep instruments moist so it doesn't dry on there. And then anytime you come across something as you're using it, and it doesn't work, always tag it. You can take it off the field. Your circulator should have some sort of need of repair tag in the room or can get one, and then separate it from the instruments so it doesn't keep getting put back in, right? Then you could always replace it in the moment if you needed another of that particular one. Hopefully there's another one. Okay. So never just keep the broken forceps or scissors or whatever in the tray. All right, so let's talk about transporting decontam items. So and we talked about centralization last week in your discussion post. You guys did a good job on that. How do you get the items that were dirty from surgery or another department, whatever, back down to decontam? So most often it's close, it's centralized. It's usually close to the OR, which is convenient, right? But while you're doing that, there's a couple things you have to remember. For one, if it came in contact with a patient at all, even if you can't see blood on it, it's contaminated. So it needs to be reprocessed. So keep clean and dirty separate. If you have like a bucket of clean, unopened items that never got used, still wrapped, whatever, that need to go back to a sterile holding area, maybe your supply room, whatever it is, as well as your cart of dirty items, you're going to have to make 2 trips. You can't push your dirty contamination cart into the clean storage area while you're, dropping them off. So keep them separate. Always wear gloves anytime you are transporting anything that's contaminated or back to decontam. Sometimes for certain facilities we'll have like suction containers that like liters that are full of fluid that was sucked up during the surgery. Anymore, there a lot of places use something called a Neptune that might have a self-contained suction system. So that's kind of gone by the wayside, but every now and then you might still have something that might splash at you. So wear PPE, face shield, all that stuff. If you're transporting carts like your case cart back to decontam, be careful. Sometimes those things have a mind of their own and they can be tricky to push. So just be careful because you don't want anything to spill out that's dirty. You don't want to hurt anybody in the process, right? And then never leave anything that has something dirty in it unattended because you don't know who's going to walk by. It may not look dirty. Maybe it looks clean and someone touches it and keeps moving for whatever reason. I don't know. Maybe you're in a hallway that has guests or patients. So always keep an eye on those and keep them covered. So let's review this definition of clean. We've talked about the definition of sterile before. So remember, sterile is the absence of all living microbes, microorganisms, including spores, okay? Now, clean has the pathogens minimized. Doesn't mean they're completely non-existent. They're just at a minimum and safe, in a way that's safe to handle, okay? So in order to do that, you're removing all soil, even if you can't see it. They're going through a cleaning process that requires the right tools, and we'll talk about some of those processes in a minute. And if it wasn't cleaned properly, if you didn't go through this whole step correctly, it can't be sterilized properly. If you left a tiny little piece of tissue on your scissors that you didn't get scrubbed off, and it goes through the sterilizer, it doesn't matter that it went through the sterilizer. It's still contaminated. You cannot sterilize living tissue. So anything that got left on those instruments If it's still there during the sterilization process, it's not sterile. And Surge Tech will get rid of it, and then they're going to be coming back downstairs to ask why it wasn't cleaned right. So you got to pay very close attention to those details. All right, so let's talk about specifically the decontamination area. This is a little blurry picture, my bad, but this is similar to what the setup will look like. You're going to have multiple sinks. We'll talk about the 3-sink system here in a second. But this is the first place that things come back to the central sterile processing area. So it receives the soiled and used items that need to be reprocessed. This is where that cleaning process, the second part of the cleaning process begins after the point of use. And like you probably figured out last week, it is cost effective to centralize the decontamination department. It makes it easier for the OR. There's usually less cost involved when you condense everything to a central place, right? So location is important, and I would say 9 times out of 10, it is very close to the operating room, because that's going to be your biggest customer, so to speak. Okay, that's where you're going to get all your dirty stuff from. And similar to the operating room, you're going to have very specific standards that have to be met for your decontamination room. So the floors and walls have to be very specific. You can't have like brick walls or a certain type of tile. Those are not conducive to cleaning. So these floors and walls have to be able to be chemically cleaned on a regular basis. Okay. Also, ventilation, the air that comes in and out of the room, has to be a minimum of 10 air exchanges per hour under negative pressure. So that, to me, when you see these types of things, like screams certification test question. So at the end of this program, when you go on to take that exam, which you will take and get certified, you need to memorize those types of things, okay? 10 air exchanges per hour under negative pressure. That means you're getting fresh air in that room and moving the dirty air 10 times an hour. It's also under negative pressure, which means as you would open a door to this room, none of that dirty air, so to speak, or contaminated air would go out into the hall. You wouldn't want that. It would stay inside. Okay. Or the temperature should be between 60 and 65 degrees. Some facilities might go 67-ish. But that's about as high as you really want it, because the higher it is, the more likely you are going to have bacterial growth, or even could affect the humidity. So you want to keep it relatively low, and the humidity between 30 and 60%. So anything higher, especially like 70, 80, 90%, really starts to allow bacteria to grow in that moist environment. The more humid it is, the more moisture there is in the air, and you don't want that. It's going to cause things to, you're going to get wet items, bacterial growth. You don't want that. Anything below 30 is going to promote more of like static electricity, which you also don't want. Okay, so that's kind of a fine line there. All right, so here are the 3 sinks, the 3-sink arrangement. So your decontam room should have something like this, because you need all 3, really. You need the first one here is the wash sink. It's the first step in the process here. This is where you're going to use water and detergent, or maybe an enzymatic cleaner. Notice the water temp here has to be between 80 and 110 degrees Fahrenheit to be effective. And then you're always going to check your cleaner's IFU, right? Every cleaner might be slightly different in how much you need per amount of water, okay? Or per even the instruments. So the middle sink is just the intermediate, but it's also used as a rinse sink. So first you're washing, scrubbing, okay? Then you're going to rinse that off with plain or softened water, which is going to remove this detergent that you just used and any debris that might be left on it. So this water needs to be changed very frequently. And then your last sink in the line is your basically a second rinse sink, your final rinse sink, that uses a different type of water, okay? So notice the difference here. Third sink uses distilled, deionized, or reverse osmosis water, okay? This is just an extra rinse to get rid of all that chemical debris, chemical detergents that are left on there, and helps prevent redepositing of minerals that might even actually be in the water as well. So one of our items that we use in the decontam room, or machines, I guess I should say, is called an ultrasonic cleaner. Some places just call it a sonic cleaner. I always refer to it as ultrasonic, but this is used for very fine cleaning, but not, notice this as not disinfection or sterilization. The ultrasonic cleaner is not a sterilizer. Its purpose is to help remove some more of that debris that may even not even be visible. So what it uses is actually sound waves. You put it in here and it like shakes it really, really fast and with sound waves. And it produces something called cavitation. So cavitation, if you look down here, is basically causing little microscopic air bubbles to burst inward, and as it's bursting, removes debris off of the instrument, which is kind of cool in how that works. So when you're using these, remember these two things. All lumens, like let's say you have a Fraser suction tip, should be filled with fluid. That way the cavitation occurs inside as well, inside that lumen. And then all hinged instruments should be open. That way you can have, that ratchet area, the shank, all of that is exposed and open to that cavitation process. All right, let's talk about our different types of detergents. Three main ones here. We have one called an emulsifier. So know the definition of each of these. An emulsifier is an ingredient used that binds two things that don't normally combine. Like if I used a real world example here, you have oil and water, maybe you're baking. Oil and water don't mix, right? You have to add a third item to get those to combine to make your cookies, whatever it is, right? So eggs is a common emulsifier. So there is some ingredient that's going to bind those two together that don't normally combine. A second one here is called surfactant. The whole purpose of a surfactant is to lower the surface tension of water, which in turn increases solubility. How soluble something is how easily it like dissolves in water. Usually it's water. And our third option here is a chelating agent. This one's a little odd. Chelating is kind of an odd word, but the whole purpose of a chelating agent is to bind water specifically to the minerals in your solution. That way the detergents don't react with the minerals, which could, end up damaging items, instruments. Okay, so all of these are going to work to really get in there, break down that debris and remove the soil from the instruments. A couple more key cleaning guidelines here when we're talking about decontamination. Pre-cleaning, these three here, these top three, different types of cleaning techniques, I guess you could say. Pre-cleaning, like we mentioned at the beginning, is at the point of use. Manual cleaning is by hand. And the mechanical would be using the equipment. For example, the ultrasonic would be an example of a mechanical cleaner. We talked about this, or hinged items should be left open. Always disassemble multi-part items. Always flush and brush your lumens. Keep especially if we're sucking up a lot of blood, that blood can dry inside that lumen very easily. So that has to take special care there. Set aside non-immersible items. If you accidentally immerse something that shouldn't be fully immersed in water, will ruin it. So be careful there. And then orthopedic instruments are going to require a little bit extra care because, you're cutting through bone. They're going to have a lot of little tiny pieces of bone stuck in instruments. I mean, it goes everywhere. Like you're using a saw, using special, like it's called a rongeur that like picks apart bone. So there's a lot of like gross debris on those instruments. So it requires a bristle brush. And then always separate your delicate items, just like you don't want to put the heavy stuff on top. You separate your delicates. Washing. All right, let's talk about disinfection. So we talked about the definition of clean. We've talked about the definition of contaminated and sterile. So what is the term disinfected? So if you disinfect something, you're using a process to make it safe for handling and further reprocessing. So if you're in the decontamination room, that's what you're doing. You're disinfecting something. Now, there's a lot of ways to go about doing this, and we use something called the Spalding classification system. Okay, that's what this little chart is here. So the Spalding separates items based on patient contact. and it dictates the level of clean that it needs to be based on the patient contact. So for example, this first one, intact skin, like no skin that doesn't have any cuts, incisions, abrasions, no breaks in the skin is intact skin. So examples of those types of items that you could use would be a stethoscope, a blood pressure cuff, pulse ox. All of those are good examples of that. So the way you would clean those items would be with a low level or intermediate level disinfectant. There are different levels of disinfectants based on the item being used, okay? So the second one here, mucous membranes or non-intact skin. So let's say you're looking into the nose. Maybe we're gonna, do a sinus scope or something. Or this right here is an EGD. Like you're gonna put a scope through the mouth into the stomach. That's a mucous membrane. Okay, so we would classify that as semi-critical, which means it has to have at least a high level disinfectant. Now, EGD scopes and colonoscopy scopes are not sterile. A lot of people don't realize that, okay? It is a high level disinfectant. There's actually now some facilities going to a single-use disposable colonoscope. It's kind of becoming more and more common anymore because I think it was a few years ago there was an outbreak of, I forget what it was, some disease. I don't know if it was hepatitis or what, but it was getting spread from patient to patient because they weren't getting cleaned properly. So, gross. And then our third classification is for sterile items, critical. So these are going to come in contact with sterile areas of the body, like you're inside, you've made an incision into the abdomen, you're, working on the heart, lungs, liver, anything internal like that has to be sterile. There can be no bacteria or spores present on those items. So those are critical. All right, some other key terms here. It's kind of a key term day. So bactericidal. Anything cidal is to destroy or kill. So bactericidal is the destruction of bacteria. You're going to see certain disinfectants say that they're considered bactericidal or classified as such. And then disinfectant we talked about doesn't kill spores. That's the key here. So here are our 3 levels of disinfection. Kind of saw that on the previous page, but high level destroys pretty much all microorganisms except for the spores, but maybe some, but not all. Okay. Not all bacteria even make spores, just throwing that out there. So it could kill some spores, but isn't guaranteed to kill all. Intermediate level is going to destroy most of these things here except for spores. And then your low level is, destruction of vegetative forms of bacteria, but no spores. Okay. So briefly here, let's talk about some of those complex items. These things have to be handled very specifically because, for one, they're very expensive, okay, especially these scopes here, and they're very delicate. So these are sensitive items that have to be processed a certain way. If you don't, it takes a lot to repair them or replace them. I'm thousands and thousands of dollars, so don't want to end up costing your facility a lot of money that way. So scopes are one of those, endoscopes. A couple different categories of endoscopes. We have rigid, semi-rigid, and flexible. So a rigid scope, I mean, it is what it doesn't bend. That's a good picture right here. This is a cystoscope, I believe. I think it's a cystoscope. Could be a laparoscope. Anyway, doesn't bend, a couple sizes, usually made of stainless steel, but it has like this optic piece, and this little piece right here, it hooks up to a light cord, which allows, a light to shine out the end. And you have semi-rigid, just similar structure to this, except that it allows a little bit of bend in the middle. Sometimes it's beneficial in urology to get through some tight spaces, okay? And then your flexible endoscopes, a lot of varieties here. Actually, we have more flexible scopes than anything because you can use it to view the bronchus, the bronchi, the stomach, which is gastroscope. Colonoscope goes in the colon. Cystoscope is for bladder. And then laryngoscope goes into the larynx. So they're all going to vary in length. And it's usually pretty obvious which one's which. All right, so how do we care for those types of endoscopes, right? In that previous picture, that first one, if I can go back here, this little silver piece that comes off the top, that is a light cord adapter. So remove those, okay? Remove the light cord adapters and any valves that got put on that have to be taken off so you can get into those spaces. Always use a neutral pH solution for your endoscopes. These, you don't want to use like those bristle brushes like your orthopedic instruments. You're going to use a soft cloth to wipe them down on the outside. You don't want to leave any, these are going to be a little easier to make marks in. You don't want that. You're going to brush any working channel. So, see if I can go back again. Kind of hard to see in this one, but like right here under this laryngoscope, that is a working channel. We have a lot of different brushes or biopsy forceps, long biopsy forceps that come out the end that go through there. So sometimes you might have tissue in that working channel. Dry it with a lint-free cloth. You don't want lint to stick to the outside. And never, like your delicate items, never place anything on top of them. It can damage the optics for sure. And then your flexible scopes are going to go through these processes here. There's a pre-cleaning that has to go through a leak test that you're going to hook it up to a machine to test to make sure it doesn't leak. Then you can clean it, and then HLD stands for high level disinfectant. That's the type of technique we're going to use. Dry it, and then it gets stored. Usually at least at my facility, our colonoscope CGGs are hanging in a special cabinet. Okay, so that's basically it for our disinfection week. If you have any questions, please feel free to reach out. A lot of you have been pretty good about that. So I try to respond as quickly as I can. If this Tuesday doesn't work for you, like getting in contact with me, just let me know. Maybe we could work something out if you're having trouble. But you guys are doing a great job so far, so keep up the good work. Bye.